I'm Dr. Marcia Sonity,
And I'm Dr. Caleb Moore,
and this is the
the
Free
Free
Smiles
Smiles Podcast.
Podcast.
So today we're talking about building high performance teams. What, in your perspective, is really I think this all kind of goes to like leadership and how that transitions into performance. What do you think about that?
Yeah, I think that for me, a lot of my journey as a leader has not really been influenced around building a team because when I was, in dental hygiene school and then going into dental school, I was a part of teams, but I was never in that leadership role. So coming out of dental school, this was almost like a culture shock in a way of you are the leader now, and what are you going to do to influence people and to build a really good team. I owned a small business while I was in dental school, a photography business, but I was basically a one-man show. So, stepping into the dental world when you are the dentist and you are running a practice and seen as a leader, it's a very different feeling. I think there are a lot of emotions that go into it. And for me, I have a few specific things that come to mind. But I would like to really focus on the leadership aspect first and what that looks like for you.
Yeah, so it's so interesting because I feel like I've always been in, not that I've like put myself in leadership roles, but just throughout my like early career, I always was like put into leadership. So
Yeah.
as an assistant, I was the lead assistant when I was at my office. As a hygienist, I was always kind of promoted to like the lead hygienist, the one that would do the training for new hires or be put in charge of things. I would say for you, me and you were leaders when it came to running the house. Like we were leaders in that sense.
That's true.
So I think it's easy to kind of forget about those things because they're almost like natural. When things happen naturally, you don't feel like you're taking on that role, but
right.
you are. I mean, yeah.
I think we're natural leaders.
Yeah.
I think that's safe to say, and I think that it's, like you said, easy to forget because, I'm like, oh my gosh, we managed a house, I was running a business, I was, so I think, okay, let me circle back. I have been a leader, maybe a natural leader, but I think that, when it comes to it, affecting your business, right, and what you're doing on, day to day, I think for us it was just innate, and it was just how we lived our lives. But now that innate feeling is transitioning into practice.
Well, exactly. And it's like leadership on steroids in a way. So you almost feel like, hey, maybe I have taken leadership roles. Maybe I've been like the treasurer for my class or the whatever it was. Like as you're like, but all those mini experiences are setting you up to take on those bigger roles because people don't ask you to lead. Like when I would come on to a new office or a new team, like the person who is your leader at that time is going to seek out people that are better leaders. And when that happens to be you often, that means that you're probably someone who has those type of skills, or you're someone who is an approachable person, or you're someone who has respect from the team and they see that, which are all, I think, leadership qualities are finding your natural ability to be someone who people want to go to for issues, but also not being the person that, just bosses people around. Like leadership to me, and like I kind of think back to like, okay, as I was like coming up through my 20s, like what did I do like without even thinking about it? Like I would read books. Like I read probably 4 or 5 different leadership books through my 20s for no reason because I just read books about things, and that just was the flavor of the few months I was doing whatever. So I feel like those books, and I can probably list them off at some point, or maybe I'll leave them in the comments, but I think they just help me to just kind of step outside my own thoughts for a second, because I feel like in leadership we find those moments where you do feel like everything's on you. You're like, I need to figure this out. Oh my gosh, everyone's like waiting for me to make a decision, or blah, 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 blah. It's like, but the nice thing that I found in dentistry is that we, as a team, I like to like bring like a lot of decisions as like, hey, what's everyone's thoughts on this?
Right.
Or even leaders that I've, been mentored under would come to me with questions like, hey, what do you think about this?
Yeah.
And I think there's a lot to that. Like as a leader, you're not like a one-man show. Leadership isn't like, hey, I'm like the boss of everyone. It's knowing, and I'm like thinking of all these like books that I read, like things that like I learned through those processes of like, hey, you're not gonna like come into a new situation and like, yes, you're the leader, but as a new doctor, you're not just gonna be like, I'm changing everything.
Right.
I'm doing this or that. I need everyone to do this tomorrow. It's a gradual thing, and it's knowing when to kind of push people into that next like role in themselves or when to step back.
It's getting the commitment from them too. So when you're stepping into that new role, I know for me, hey, I have standards, or this is how I see myself as a provider. This is the level of care I want to give my patients. Do you feel the same way? Is that a goal of yours? And along with that, if your current systems that are in place may not be in alignment with mine, are you committed to learning some new, or not even learning, but are you committed to this journey of growing with me? So that way we can grow together and learn how each other like to communicate with one another, how we like to work, how we speak to patients, and really just grow together, get that commitment from them in the beginning. And also, let them know that not only is it going to be your way or the highway, right? But you're going to learn things from your assistants or from your front desk. So we're going to be learning from each other and really just finding a way to integrate how we both operate or think into one system together, right? And I think, it was 2017 when I came out of hygiene school. I started working for this office in a very small town, but I had taken the DISC assessment like years ago.
Oh yeah, the DISC assessment's a great one.
Yeah.
I've taken a couple, but I feel like the DISC is the one that's kind of stuck with me the longest.
Yeah,
I can relate to that.
And I was really young at the time and didn't really understand. If I'm being honest, at the time I was like, this is annoying. Why am I doing this? Like, I just want to come in and work. But looking back now, it really allows you to understand how people want to be spoken to, how they're going to take feedback, how they want to speak to you, and also what type of provider are they for your patients, and really just a collaborative approach by knowing each other's strengths and maybe also their weaknesses and how you can, work together.
Yep.
So.
I think, and the one thing that spoke to me when you were talking was, coming in and like collaborating and having those conversations with your team. And what I loved doing, and I think what built our really strong team in the first office I worked at as an associate was I arranged to have like one-on-ones with each of the team members. So being like, it's not just me one-on-one, it's me, my other associate that I was working with, and then my office manager. We just have everyone sign up for a day that month, be like, hey, we're just meeting for about 30 minutes. And I wouldn't start that with like, hey, we need you to do these things. Right. It was like, hey, how do you think your day-to-day is going? Yeah. What do you think would make your day easier? What do you think make your day better? What do you think would be a better thing for your patients? Or XYZ. Right. What are the things that you're finding that are making your day more stressful that we are probably all feeling or seeing, but it's just like finding those different perspectives from different people. Then you have a compilation of, okay, I've met with all 10 team members by the end of the month. Now we have all this data. How do we meet for like our next team meeting? And then discuss all these things. Be like, hey, all of you are saying this, this, and this.
Yeah.
Maybe anyone, and then you're bringing up like more of a conversation with everyone versus like, we all know there's a problem. We're not putting more like a list of problems out there. We're putting a list of solutions.
I agree. And I think along with that, having those one-on-ones is really, really important, and understanding what your team wants from you and what they want from their day-to-day. And that could be as simple as, I had this one assistant in the first office that I was working in, and her and I worked really well together. There was a lot of growth on her end and my end during that time. But she told me, she was like, one thing I cannot stand, from other doctors that she had worked with is when you don't look me in the eye. Like if I'm coming to get you for an exam, or if I'm telling you about my weekend, like I want you to look at me in the face when I'm talking to you. And so from that day forward, I made sure that anytime she's like, Dr. Moore, I'm ready for you, I'm like, I'm looking, Yeah. And because I respect her and I respect that relationship, and I want her to know that I heard her, I know how she likes to communicate, and I want to make sure that she feels like I support her throughout the day. because at the end of the day, our building a team, your team, it's a team for a reason. They're helping you in so many ways, and making that small change, I could tell, like, meant the world to her. So yeah.
Well, and that's part of, like, you're building relationships.
Yeah.
And I think there's a line you need to draw when it comes to building relationships with your team. Like, I know there are certain practices where you walk in and there's a lot more like drama, or there's a lot more like people feel like personally offended by certain things, or they're like, oh, the doctor did this or that and I feel this way, and it's like, but that's because your team is set up in a way that they probably respect you and you're probably the leader, but you're also setting a tone where they get more emotional about things with
Right.
you, or you're allowing that kind of like drama to persist within your practice. And I feel like it's I don't know how to teach that. I don't know how to like be like, hey, not that you can't have like someone that comes to you, like one time, I've had like hygienists who I've worked with that just had like, I had a really tough patient today. I just need to like talk to you about it, and maybe that brings up tears, and maybe that brings up like a really like a vulnerable moment for them. And I'm not going to sit there and be like, not like listening or not like trying to understand where they're coming from. But I'm also not overly dramatizing it and like bringing that like more drama into that situation. Or maybe one of my I had an assistant one time that worked with me for a short period, and I forget what it was. She like brought up an issue with me with like the front, how the my office manager said something to her. I mean, mind you, I'm not the owner of the practice.
Right.
I'm just an associate. So I'm not that I have anything to do with it, but people saw me as a leader in that practice, and maybe I just was like someone that was hearing her and like listening, but I wasn't sitting there egging on that situation. I was finding a neutral stance so she could feel heard, so she could feel like someone's hearing her, but not perpetuating the issue. So then that problem grows, and then we met as a tribe, the three of us, and then we talked about the situation. Like there's a lot of like interpersonal things that we had to deal with on a daily basis. But I feel like the more you approach it as like a neutral party in most situations, and have that empathy of like, hey, I know this was tough for you. I see how you feel. Like, I understand where you are coming from and how you perceive the situation. I think in this person's perspective, they didn't mean it that way.
Right.
Well, or whatever this, the outcome of that would be. Yeah.
I think too, that brings me to a point of, hiring and firing, and what does that look like when you're trying to build a team? Because when you have an assistant, or you have another doctor, or someone who may be a little bit more dramatic, or is, they're crossing the line, they don't have boundaries in place when they're at work, they can't stay in their bubble, what do you do about that? And I know one thing specifically that our office, that we have recently, I have two examples from like the last 2 weeks, and I won't harp on them, but one specifically being that in Colorado specifically, there's a hygienist shortage. So the hygienist, we were both hygienists. I value my hygienist a lot. However, they're at this point where they have a lot of power as well, to the point where, we're desperate to have our hygienists because we need them. But what happens when when maybe they're a bad apple, or they're not aligning with the vision of the practice, or they're calling off every Monday or Wednesday, just unprofessional behavior. It's like, at what point do you keep somebody on, even though clinically you're desperate for them, but they're the bad apple in the group and they're affecting the rest of the team in negative ways? So I think it's having that hard cutoff of, we really value and respect you, but when you agree to work with us, these were the expectations that we had set. You're not meeting them, but we have to let you go. And I think protecting your team and protecting the culture of the practice is really important, and being able to make those hard decisions. Like, I know that hygiene is going to look a little funny for the next couple of weeks until we find another fit, but it's actually more beneficial to our team to let this person go than to let them continue this behavior in the practice.
Oh, that's so true. And I think it's more like, when that person is like a toxic person, because you have a universal stance among your entire team that if that person does call off that day, everyone's day is actually better.
Yeah.
that's a red flag. That's like, this person probably isn't bringing more to the team than they're taking away every day.
Yeah.
I mean, we had that with an assistant once. I was chopping onions before I started this, so my nose is running. We had that with an assistant, and she started calling off all the time. I mean, she was, I would say, a great assistant when she was there,
Mm-hmm.
as far as hand skills and things like that go. But everything else was always like there was some kind of like fire to put out in her mind,
Yep.
So, it took some time. It took some, some finagling, but also like people coming to us one-on-one being like, hey, so-and-so did this and it made me feel this way. Or now, like, I had one of my team members who started going to therapy because of like this person's like whatever. And, obviously everyone has their own way of handling toxic people. But, it's to the point where like, if you're making other team members go to therapy, then maybe we need to talk about
Right.
a different fit for that person.
Exactly.
Yeah.
And I don't think, whenever you're looking for that new team member to bring onto your team, are they coachable? Are they going to integrate well with your current team? What is the morale like? And how are they speaking on their previous providers and their previous team? And why are they looking for a new office in general?
Mm-hmm.
And so, we just had a working interview with an assistant this week, and she's really young, which I don't think means anything. I think we were young and we were really successful.
I honestly will say some of my best assistants were young, no experience at all, but they were very eager to learn and they were very driven.
And that's all it takes.
Yeah.
She was so helpful throughout the day, even though she didn't know how to work, the software, the computer, or the X-ray. She didn't know where, X, Y, and Z was. She was always asking, and she was jumping in. How can I be helpful? The team, at the end of the day, maybe on paper, her resume wasn't as good as another working interview that we had, but it's almost, and I told my practice manager this. I said, for me, as a leader, I actually feel that I prefer to have a little bit more patience and understanding in the beginning to coach someone who wants to be coached than to try and work with someone who is stuck in their ways and thinks that, a sense of entitlement or, that they shouldn't be doing this because they've been in the field for 10 years, So I think that there's a lot of value in adding to your team. And it may not be, someone with the most experience, but it's looking for those key phrases that they say or their attitude or the questions they're asking you, So.
Yeah. No, I think that's something that you have to know within yourself. So some people, I've worked with these people. Like I've worked with doctors that they don't want to train people. They don't want to coach people. But then your team is going to reflect that part of you not wanting to train people because they're not going to learn. They're not going to grow. Things are going to be stagnant. You're going to be more frustrated because they're trying, there are people that will figure things out and like learn as they go. I feel like I was one of those people as an assistant. I just, sought out information, but there's also, like, if you're working with a few different assistants or there's, one that's struggling, one that needs a little more attention on something else, like, you need to be able to help that person grow in a way that is productive for your office, or you are going to be stagnant. That person is going to, like, kind of, slow down, whatever, or be the, unproductive, member of your team.
Right. And I think, it's having those maybe uncomfortable and tough conversations with them in the beginning, like you said, those one-on-ones, to figure out where they want to grow, like what does growth look like for you this year? What procedures do you really like or that you really enjoy, and what don't you enjoy? And having that as a baseline for all your team members, so that way everyone feels fulfilled throughout their day. Because at the end of the day, the drama, the animosity, the cattiness, it's going to come from people who are unhappy. And so it's getting to those whys, like why are you unhappy at work and how can we make it better for you? So I think that's been really helpful, because I've transitioned into a new practice and the team, the culture there, I'm very blessed. They all work together really well. They joke, when it's appropriate. And I think, but there is, that one hygienist or that one assistant who cries every time you give them a little bit of feedback, even though you've had those conversations of how would you like to receive the feedback? It's like, no matter what you do, they're always going to have their own emotion behind it. but trying to set your team up for success in the beginning by really getting to know them and what they value in the beginning.
And I think that's something that I keep in the back of my mind always, is that I can always learn from people around me, even if their experience level is like a fourth of mine. It doesn't mean that person doesn't have a valued perspective. They see something differently than I do. Like that's why dentistry is a team sport. You know, like that is why we do have a hygiene that, you know, they look at things, they're co-diagnosing with us, they're the first kind of like a line of looking at a patient and getting to know them. And then we're coming in, the assistants are like literally like the support team for everyone. And if we're not cohesive, and if there are people that like don't feel like they can continue growing, then yeah, you know, maybe that person, like, you know, their days are numbered mentally anyways. Maybe they are ready to like retire, or maybe they are like, hey, I probably have like 1 or 2 more years because I've been a hygienist or a, you know, assistant for 40 years. Like that's a long time to be doing what you're doing.
Yeah.
But I still think there's a difference between someone who's been doing this for 40 years who's still trying to learn.
Exactly.
Yeah.
Yeah, and so I think it's having the core value of a growth mindset. Do they want to integrate with the team? And, you know, are they asking us questions like, what can I do for the office, and how can I be of value? And, you know, how are you going to support me? So, yeah, I think those are all important aspects, no matter what your age level is or, you know, how many years you've had in the field.
Yeah, I mean, I think at the end of the day, it's about identifying the right kind of team member in the beginning. Like when you're interviewing, having those questions ready that really spark like what that person's true personality is, because you will notice red flags kind of in an interview when someone's very critical of their previous person they worked with, or they kind of point fingers at things. They said, oh, this happened to me. Like they're very like, things happened to me and this is why I'm leaving, versus, hey, I'm moving on because I'm moving a different state or a different city. Like that's a very different reason to search for a new job. Or, hey, like I thought this office was, you know, this kind of environment, and then I got to know them, and really the environment wasn't what I thought I could grow and learn into, and these are my goals moving forward. Or asking someone what their goals are, like what do they want out of that experience. So it's finding those things out, finding how people want to receive feedback, and knowing how to have hard conversations. And I think having like, you know, nipping things the moment something happens, like if something occurs within like me and a team member, I want to talk about it that evening before we go home, or I want to talk about it the very next morning, so I'm not sitting there, you know, contemplating like, oh, is this going to be an ongoing issue? Is this going to be a thing? Am I going to have a whatever? Like I like to talk about things in the beginning so things don't pile up, and not ignore them, and doing it properly. Like not being like, oh, you did this. Being like, hey, like we had this patient yesterday. This is how I perceived that situation, how it happened. What do you think, and how could we have handled that better?
Right.
Like very simple things. It's not like pointing blame. It's just being like, hey, what's your perspective on this?
Yeah, and it's not always about, you know, the feedback you're giving or growth. It's letting your team know that you're also human and vulnerable, and that you care about how they feel. And I think, you know, showing positivity and inquiring at the end of the day, if it was a really tough day, like, thank you so much for, you know, being my rock today. Was there anything that you needed from me, or, you know, how are you doing? You know, or how's your, what do you have planned for the weekend? So
oh my gosh, yeah, it's little things, yeah. And I feel like whenever I'm leaving an operatory, especially if we have like a really like a heart procedure or a difficult patient, or I mean, I say it just as a almost like a default now, is like I always thank my assistant, I always thank my hygienist when I'm leaving the room. If they do something noteworthy in that appointment, I'll make sure to like try to remember to like bring it up later, like, hey, like really good call today on, you know, getting the bite block out when this was happening, you know, something so like minute and just like part of your job. But like, you know, people still like to hear thank you when you did a good job. Like that's a very human thing that, you know, it's not like we're giving away like participation trophies just for showing up that day, but it's still like I'm saying thank you, and I'm making sure before I leave, even if I'm, you know, done my patients early, that other doctors still seeing people, like I'll stop into the room and say, hey, do you guys need anything? Every time I was leaving my my whatever office I was working with as a hygienist, I always made sure everyone was good before I left.
I think that speaks volumes. I really hope that this has given everybody insight on what being a leader looks like. Dr. Marsha, if you could please leave in the comments some of your book recommendations.
Oh yeah, I got books for days.
Yeah, I mean, so many recommendations, and I will as well from some of the ones that really influenced me. But one of the golden rules that I follow is like hire slow and fire fast, right? Make sure that you're protecting your team and really taking the time to get to know someone before they're joining your team.
Yep, 100%.
Yeah, and I think next week we're coming back. We're going to talk about clear aligners and what that looks like for a general practitioner.
Thank you so much for listening. If you enjoyed this episode, please share it with a friend. Don't forget to leave us a comment, rate us, and subscribe so you never miss an episode. We appreciate your support and look forward to bringing you more great content.